Hello, thank you for joining us. A lot of individuals wonder what fatigue is and how do they know if they're dealing with fatigue or something else after a brain injury. Today, we'd like to chat a little bit about fatigue after brain injury and help individuals understand what this looks like and how to cope with fatigue after brain injury. So, this is what fatigue can feel like. It can present in a variety of ways: physical, psychological, mental, for example. So, physical fatigue may present as just an overall feeling of physical exhaustion, a lack of or a loss of energy, and just this constant need to rest. Psychological fatigue is really more of a feeling of not being able to feel motivated to do the things that you maybe used to enjoy doing or need to do, and possibly feeling depressed. Mental fatigue is feeling like you can't really concentrate. You might find it hard to stay focused on things, and your mind sometimes either goes blank or wanders a lot, and you can't focus on the things that you'd like to be working on. So, how common is fatigue? It's actually one of the most common problems after brain injury. The research shows that as many as 70% of brain injury survivors, TBI and stroke, for example, both complain of mental fatigue. So, it's a very, very common problem after brain injury. We might hear people say, "Well, I get plenty of sleep, so why am I, feeling this fatigue? Am I just tired?" So fatigue after a brain injury or a stroke is often can be often confused with being tired. Fatigue tends to be different, however, because it arrives without warning, and rest does not always make it better. So every individual experiences fatigue a little, in their life, which is a normal thing. But it's going to feel a little bit like hitting the wall physically, emotionally, or mentally. So kind of hitting your limit all of a sudden. So what causes fatigue after a brain injury? Um, Fatigue is a normal part of life for everyone, but in brain injury, it's different. It's really unclear what really causes the fatigue that individuals experience after brain injury, and it very much varies from person to person. It's possible in some individuals that there's actually a deficiency problem in the brain function, which causes some fatigue. There's also other factors that can come into play causing fatigue, like muscle weakness, for example, medications that people might be taking, dealing with headaches, additional medical conditions that they might be dealing with, like thyroid disorders, for example, or vitamin deficiency. All of these things could be a cause in the fatigue that someone might be experiencing after brain injury. Some other problems that really come into play and could lead to fatigue after brain injury would be things like depression, um, sleep problems, stress, and poor nutrition. These are all things that, if addressed, can sometimes really be improved and see some improvement in that fatigue after brain injury. So fatigue can also occur after a mild brain injury, like a concussion. It's very common to see some fatigue in individuals after a mild brain injury, like a concussion, but it typically resolves in 2 to 3 weeks, like most other post-concussive symptoms do. It doesn't linger like it tends to in some of the other more moderate to severe brain injuries. It tends to alleviate within that first couple of weeks after a concussion. Here's just some additional causes that might come into play causing fatigue in individuals after brain injury. And really just looking at those additional medical or other symptoms that individuals might have that are going to increase the fatigue that they might be experiencing. So what do we do to decrease fatigue for folks that are dealing with this after a brain injury? Fatigue can be extremely life altering, causing individuals to have a lot of dissatisfaction with things they used to enjoy. And it can be debilitating for some, limiting their ability to complete the demands of work, school, or whatever responsibilities they might have, like parenting, or just enjoying things in their recreational life. Um, they may not be able to function in the same capacity as they were before the brain injury. So, what can be done to decrease that level of fatigue? The first and truly most important thing to do is to start to identify the early signs that people might be displaying that could indicate that there's some chronic fatigue going on here, like irritability or perhaps being easily distracted. If you see an increase in those symptoms, it might be something worth noting to pay attention to, that fatigue might be causing those things. So once you identify what physical and environmental triggers for fatigue are happening for you or your loved one, you can try to be more planful with your schedule and your activities in your daily life. So you can try to reduce the things that are causing the fatigue. So for example, setting a regular sleep schedule and following it is very helpful. Trying to take breaks or naps so your mind and your body can be a little bit more efficient. Increasing exercise is something that has been shown to really help alleviate or decrease the level of fatigue that individuals might be having. Another suggestion is to really avoid alcohol or any illicit drugs, and keeping caffeine intake at a minimum, and really only keeping that caffeine intake in the morning can really help prevent fatigue in individuals, especially if sleeping is also a problem. These things can actually be used to decrease depression and improve the symptoms of depression as well, and improve sleep. So another thing to really think about is planning your schedule and sticking to it. So prioritize your activities. If there's something that comes up in your schedule that needs done first, that wasn't on the schedule before, um, you have to add that into your day. Then remember to bump something off that has maybe lesser importance for that day or that week, so you're not going to be overdoing it. Try to plan the activities that require the most effort to be in the morning. So this will leaving the less involved and stressful activities in the afternoon and evening, so you don't have to, when you may not have as much energy and your fatigue levels aren't as high, then leaving those less strenuous things for later in the day. So sometimes with brain injury, fatigue can linger. Even after trying your best to make the accommodations and the adjustments in the lifestyle, planning for things, keeping your schedule, as we've discussed, sometimes you just may need to consult with your primary doctor or a specialist for a different, more specialized plan if things are really just not able to be adjusted to make things manageable. So this could, in taking it to a doctor, this could include something like reviewing what your current conditions and medications are, and then taking into consideration what your lifestyle demands are to determine what the doctor might be able to adjust from a treatment perspective. So fatigue is actually very common in caregivers as well as survivors. And so this is a very important fact to recognize. Compassion fatigue is an actual form of physical and emotional exhaustion that comes from caregiver burnout. Caregivers should really remember this and plan for this and be sure to take time for themselves and take frequent breaks. And so if you would like more information about compassion fatigue or caregivers getting the support that they need, take a look at this link here. But really, several of the recommendations that we've discussed here are similar and would be the same recommendations that we've suggested for the individual with the brain injury. So there's a lot of information out there that talks about fatigue after brain injury. Here are some of the sites that we've used to put together the content that we have discussed today. I would encourage you to take a look at some of these sites to get some more detailed information. There's some good fact sheets out there that talk about these things to have at hand. But give us a call if you have specific issues or things that you're dealing with that you maybe feel like you need a little bit more information on. We can always try to assist if you want to give us a call or email us at our email address. We also have a caregiver, a survivor and caregiver Facebook page that individuals are encouraged to go to and ask questions to their peers about what might work for them in some of their situations. And we also have support groups that we can give you information about across the state. So thank you for joining us today. Feel free to give us a call if you have more questions about fatigue after brain injury. We'd be happy to try to help. Thank you.